CEN Exam Prep Download. Question 1. A patient presents with a complaint of severe headache and photophobia. The patient has a temperature of 101 degrees Fahrenheit and nuchal rigidity. Which triage category is most appropriate? Option A, ESI 1. Option B, ESI 2. Option C, ESI 3. Option D, ESI 4. The correct answer is option B, ESI 2. A patient with fever, nuchal rigidity, and photophobia is at high risk for meningitis and requires rapid assessment, ESI 2. The patient is not unstable enough for ESI 1A, but needs to be seen quickly. Question 2. A patient presents with a chief complaint of suicidal ideation. Which of the following questions would be a priority for the nurse to ask? Option A, do you have a plan? Option B, what medications do you take? Option C, do you live alone? Option D, have you attempted suicide before? The correct answer is option A. Do you have a plan? When assessing a patient with suicidal ideation, determining if they have a specific plan, means, and intent is the priority. This directly addresses the patient's immediate risk. Other questions, B, C, D, are relevant for history but do not assess imminent risk as directly. Question 3. The nurse is triaging a child complaining of fever and rash for 3 days. The nurse notices the appearance of blue-gray spots with a red base on the inside of the child's mouth and a maculopapular rash on the face. Where would be the best location for this patient following triage? Option A, return to the waiting room in line of sight of the triage nurse. Option B, resuscitation bay to prepare for intubation. Option C, isolation room on droplet precautions. Option D, isolation room on airborne precautions. The correct answer is option D, isolation room on airborne precautions. The child's symptoms, colic spots, blue-gray spots with a red base on the buccal mucosa, and maculopapular rash, are classic for measles, rubella. Measles is transmitted by airborne particles and requires airborne precautions with N95 mask and negative pressure isolation. Droplet precautions, C, are not sufficient. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient with increased intracranial pressure is at risk for Cushing's triad. Which of the following comprises Cushing's triad? Option A, hypertension, bradycardia, irregular respirations. Option B, hypotension, tachycardia, tachypnea. Option C, hypertension, tachycardia, Shane-Stokes respirations. Option D, hypotension, bradycardia, hypoventilation. The correct answer is option A, hypertension, bradycardia, irregular respirations. Cushing's triad is a late sign of increased ICP, indicating herniation is imminent. It consists of hypertension, widening pulse pressure, bradycardia, and irregular respirations. This compensatory response is the body's attempt to maintain cerebral perfusion. Question 5. A patient is brought in with a nail gun injury to the chest. What is the priority nursing action? Option A, remove the nail. Option B, apply pressure to the wound. Option C, obtain a chest X-ray. Option D, assess for pneumothorax. The correct answer is option D, assess for pneumothorax. A nail gun injury to the chest can cause pneumothorax, hemothorax, or cardiac injury. The priority is to assess the airway and breathing. The nail should not be removed, A, as it may be tamponading a bleeding vessel. Pressure, B, may be applied but the priority is assessment. Chest X-ray, C, will help determine injury but follows assessment. Question 6. A patient with heart failure presents with acute pulmonary edema. The nurse anticipates which initial medication? Option A, for furosemide. Option B, for morphine sulfate. Option C, for nitroglycerin. Option D, for dobutamine. The correct answer is option C, for nitroglycerin. For acute pulmonary edema, for nitroglycerin is often the first-line medication as it causes venous and arterial vasodilation, reducing preload and afterload, and quickly relieving symptoms. Furosemide, A, is used for diuresis but takes longer to work. Morphine, B, is used cautiously and is not typically first-line. Dobutamine, D, is for cardiogenic shock with low cardiac output. Question 7. A patient presents with a jellyfish sting. Which of the following is an appropriate first-aid measure? Option A, apply fresh water to the area. Option B, apply vinegar to inactivate nematocysts. Option C, apply heat to the area. Option D, rinse with seawater and apply ice. The correct answer is option B. Apply vinegar to inactivate nematocysts. Vinegar, acetic acid, should be applied to jellyfish stings to inactivate the nematocysts and prevent further venom release. Fresh water, A, can cause nematocysts to fire. Heat, C, is sometimes used for pain relief but not for inactivation. Rinsing with seawater, D, is acceptable but vinegar is preferred. Question 8. A patient presents with severe right upper quadrant pain radiating to the right shoulder, nausea, and vomiting. The nurse anticipates a diagnosis of Option A, acute pancreatitis. Option B, acute cholecystitis. Option C, peptic ulcer disease. Option D, gastritis. The correct answer is option B, acute cholecystitis. The classic presentation of acute cholecystitis is severe right upper quadrant pain radiating to the right shoulder or back, Care's sign, along with nausea and vomiting. Acute pancreatitis, A, pain is epigastric and radiates to the back. Peptic ulcer disease, C, is epigastric pain. Gastritis, D, is epigastric burning or pain. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient is brought in with a diagnosis of schizophrenia who is actively hallucinating. What is the best nursing approach? Option A, tell the patient the voices are not real. Option B, ask the patient what the voices are saying. Option C, ignore the patient's hallucinations. Option D, place the patient in restraints. The correct answer is option B. Ask the patient what the voices are saying. It is appropriate to ask the patient about the content of hallucinations in a non-judgmental manner. This helps assess for command hallucinations that may be dangerous. Telling the patient the voices are not real, A, denies their experience. Ignoring, C, is dismissive. Restraints, D, are unnecessary unless the patient is a danger. Question 10. Which of the following is the earliest sign of cardiac tamponade? Option A, muffled heart sounds. Option B, JVD. Option C, pulsus paradoxus. Option D, hypotension. The correct answer is option A, muffled heart sounds. The classic Beck's triad includes muffled heart sounds, JVD, and hypotension. Muffled heart sounds are often the earliest sign because fluid accumulating in the pericardial space dampens the audible heart sounds. JVD, B, occurs as right heart filling is impaired. Pulsus paradoxus, C, is a later finding. Hypotension, D, is a late sign indicating severe hemodynamic compromise. Question 11. The nurse is caring for a patient in cardiogenic shock following an ME. Which hemodynamic parameter is expected? Option A, elevated CVP, elevated PCWP, low cardiac output. Option B, low CVP, low PCWP, high cardiac output. Option C, elevated CVP, low PCWP, high cardiac output. Option D, low CVP, elevated PCWP, low cardiac output. The correct answer is option A, elevated CVP, elevated PCWP, low cardiac output. Cardiogenic shock is characterized by pump failure, leading to elevated filling pressures, CVP and PCWP, and reduced cardiac output. Options B and C describe distributive shock, such as sepsis or neurogenic shock. Option D is not consistent with any shock pattern. Question 12. A patient is brought to the ED after a witnessed seizure lasting 8 minutes. What is the priority nursing action? Option A, administer 4-lorazepam. Option B, assess for head injury. Option C, obtain a stat CT scan. Option D. Perform a detailed neurological assessment. The correct answer is option A. Administer 4-lorazepam. A seizure lasting more than 5 minutes is status epilepticus, a neurologic emergency. The priority is to terminate the seizure with benzodiazepines, lorazepam or diazepam. While head injury assessment, B, and CT, C, are important, the seizure must be stopped first. A full neuro assessment, D, will be performed after the seizure terminates. Question 13. Which laboratory finding is most specific for acute myocardial infarction? Option A, elevated creatine kinase -MB, CK -MB. Option B, elevated troponin I. Option C, elevated myoglobin. Option D, elevated C- reactive protein. The correct answer is option B, elevated troponin I. Cardiac troponins, troponin I and T, are the most specific biomarkers for myocardial injury because they are found exclusively in cardiac muscle. Troponin I is not found in skeletal muscle, making it highly specific for myocardial infarction. CK-MB, A, is elevated in cardiac injury but can also be elevated with skeletal muscle damage. Myoglobin, C, is early but nonspecific. CRP, D, is a marker of inflammation and is not specific for me. Question 14. A patient presents with acute urinary retention. The nurse anticipates the need for Option A, Foley catheter insertion. Option B, straight catheterization. Option C, condom catheter. Option D, suprapubic catheter insertion. The correct answer is option A, Foley catheter insertion. For acute urinary retention, insertion of a Foley catheter provides continuous drainage and allows monitoring of urine output. Straight catheterization, B, may be used, but Foley is preferred to prevent repeated catheterizations. Condom catheters, C, are for incontinence, not retention. Suprapubic catheter, D, is used when urethral catheterization is not possible. Question 15. A patient's ABG results show pH 7.25, PaCO 255 mmHg, HCO 324 milliequivalent/L. What is the most likely interpretation? Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory acidosis. Option D, respiratory alkalosis. The correct answer is option C, respiratory acidosis. The ABG shows a low pH, acidemia, elevated PaCO 2, greater than 45 mmHg, and normal HCO3. This is consistent with acute respiratory acidosis from hypoventilation. Metabolic acidosis, A, would show a low HCO3. Metabolic alkalosis, B, would show elevated pH and HCO3. Respiratory alkalosis, D, would show low PaCO 2. Question 16. A patient presents with sudden onset of sharp chest pain and dyspnea following a long flight. What is the most likely diagnosis? Option A, spontaneous pneumothorax. Option B, pulmonary embolism. Option C, acute coronary syndrome. Option D, pericarditis. The correct answer is option B, pulmonary embolism. This patient has risk factors, prolonged immobility from a long flight, and classic symptoms of pulmonary embolism, sudden dyspnea and pleuritic chest pain. While spontaneous pneumothorax, A, can cause similar symptoms, the history of prolonged travel makes PE more likely. ACS, C, presents with chest pressure with radiation. Pericarditis, D, pain is positional. Question 17. A patient presents with acute kidney injury. Which laboratory finding is most consistent with prerenal azotemia? Option A, Bun/CR ratio 20:1. Option B, Bun/CR ratio 10:1. Option C, normal Bun/CR ratio. Option D, elevated CR with normal Bun. The correct answer is option A, Bun/CR ratio 20:1. In prerenal azotemia, decreased renal perfusion, the Bun/CR ratio is typically 20:1 due to increased reabsorption of urea. In intrinsic renal disease, the ratio is typically 10:1, B. Normal ratio, C, and elevated CR only, D, are not characteristic of prerenal azotemia. Question 18. A patient presents with a severe allergic reaction with difficulty breathing and hypotension. What is the priority medication? Option A, diphenhydramine. Option B, epinephrine. Option C, albuterol. Option D, hydrocortisone. The correct answer is option B, epinephrine. Anaphylaxis is a life-threatening emergency requiring immediate epinephrine. Epinephrine is the first-line treatment for anaphylaxis with respiratory or cardiovascular compromise. Diphenhydramine, A, albuterol, C, and hydrocortisone, D, are all used but are secondary to epinephrine. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient with a history of DVT presents with sudden onset of chest pain and dyspnea. What is the priority nursing action? Option A, administer oxygen. Option B, obtain a 12-lead ECG. Option C, prepare for CT angiography. Option D, administer heparin. The correct answer is option A, administer oxygen. The ABCs are the priority. Administering oxygen to treat hypoxemia is the first step. ECG, B, is used to rule out me but is secondary. CT angiography, C, is diagnostic but not the priority. Heparin, D, is treatment but follows oxygen and diagnosis. Question 20. A patient presents with abdominal pain, vomiting, and a blue-gray discoloration of the gums. What heavy metal poisoning is most likely? Option A, mercury. Option B, arsenic. Option C, lead. Option D, iron. The correct answer is option C, lead. Lead poisoning can cause abdominal pain, lead colic, vomiting, and the classic blue-gray lead line at the gingival margin. Mercury, A, causes neurological symptoms. Arsenic, B, causes garlic odor and GI symptoms. Iron, D, causes GI symptoms and metabolic acidosis but not gingival discoloration. Question 21. A patient presents with a temperature of 101.4 degrees Fahrenheit, heart rate of 110 beats/min, and respiratory rate of 26 breaths/min. To consider if the patient may have sepsis, the nurse should assess if the patient has Option A, a possible infection. Option B, positive blood cultures. Option C, an immunocompromised state. Option D, been febrile over 24 hours. The correct answer is option A, a possible infection. According to the current definition of sepsis, a patient with signs of infection, fever, tachycardia, tachypnea, should be assessed for a possible source of infection. Sepsis is defined as life-threatening organ dysfunction caused by a dysregulated host response to infection. Positive blood cultures, B, are not required for diagnosis. Immunocompromised state, C, is a risk factor. Duration of fever, D, is less relevant. Question 22. A patient with a diagnosis of bipolar disorder is brought in for mania. Which of the following is a priority nursing intervention? Option A, administer lithium immediately. Option B, ensure the patient is in a safe, calm environment. Option C, restrict fluid intake to prevent water intoxication. Option D, place the patient in seclusion. The correct answer is option B, ensure the patient is in a safe, calm environment. Safety is the priority. A calm, safe environment with decreased stimulation can help manage manic behavior. Lithium, A, may be prescribed but administration is a provider order. Fluid intake, C, should be monitored but lithium requires adequate fluid intake. Seclusion, D, is only for imminent danger. Question 23. Which of the following is a true statement about do-not resuscitate, DNR, orders? Option A. A DNR order indicates no further care should be given. Option B. A DNR order is a standing order for all patients. Option C. A DNR order is written by a physician after discussion with the patient or family. Option D. A DNR order can be written only by the patient's family. The correct answer is option C. A DNR order is written by a physician after discussion with the patient or family. DNR orders are written by a physician after discussion with the patient or healthcare proxy. DNR does not mean no care. A. It means no CPR. DNR is not a standing order. B. Family, D. Cannot write the order but can participate in discussion. Question 24. A patient with a known history of type 1 diabetes presents with nausea, vomiting, and a blood glucose of 450 mg/dl. ABG shows pH 7.15, HCO 312 milliequivalent/L. What is the priority intervention? Option A. Administer regular insulin 4. Option B. Administer 4 fluids. Option C. Administer potassium. Option D. Obtain a urine ketone test. The correct answer is option B. Administer 4 fluids. In DKA, fluid resuscitation is the first priority to correct dehydration and improve perfusion. Insulin, A, is given after fluids. Potassium, C, is given after the patient is rehydrated and potassium is monitored. Urine ketones, D, are important but not the priority. Question 25. A patient presents with an acute shoulder dislocation. The nurse notes the arm is held in abduction and external rotation. What is the most likely type of dislocation? Option A. Anterior dislocation. Option B. Posterior dislocation. Option C. Inferior dislocation. Option D. Superior dislocation. The correct answer is option A. Anterior dislocation. Anterior shoulder dislocation is the most common type and typically presents with the arm held in slight abduction and external rotation. Posterior dislocations, B, are less common and present with the arm held in adduction and internal rotation. Inferior, C, and superior, D, dislocations are rare.